Welcome back to the next episode of What Your Doctor is Not Telling You. Dr. Mollie James here, and tonight we have a good one. Thanks for being here because this is an issue that affects so many people. Advanced fibrosis. So again, we're talking bariatric surgery. We're going to get serious with this. And I will give you my take on bariatric surgery. When I was a surgery resident, this was very in vogue, and so I spent a lot of hours at the bed in the operating room during these operations watching. Basically, what you have done is take an addictive person with an addictive personality and addiction problem, and you've made it so they can't do their addiction. So they physically can't eat anymore. So guess what happened? A lot of them started drinking. So if you look at the data and you look at it, a large percentage of people who underwent a bariatric surgery, because we didn't take care of the root cause, we patched it with a procedure. Now they've shifted their addiction to something they can drink. So interesting. I've seen it turn into the Dairy Queen malts and shakes, but I've a lot seen it turn into whiskey and vodka and hard liquor because they can drink it and it feeds the addiction. And then cirrhosis. So again, this is your standard medical playbook right here. I'm showing you what they do. And I don't see anything in here that's not prescribe something and test something or operate on something. So in your cirrhosis, you're going to do cancer surveillance every 6 months. So you're going to do an ultrasound. And then once it's really bad, we're going to sign you up for a liver. And if any of you have been following on Twitter some of the organ donation stuff, I'm not quite where some of the high activists are, but I definitely saw situations in which you would not be comfortable with your tax dollars going to pay for liver transplants. So our playbook is much better, as you can imagine, or we wouldn't be here tonight. So we're going to start at the lowest stages. This is everything we do is a pyramid, right? You always have to start with the foundation. Sleep. Are you sleeping at night? Are you getting good restorative sleep? Are you eating the right things? And the right things aren't one set of right things. Are you eating the right things for you, that you want to eat, that you enjoy eating, that are good for your physiology? Are you moving? All of us have to move. If you sit in a chair all day, every day, you will not be a healthy person. It's not possible. Metabolic repair. So again, we've got to go back and we've got to reverse the high insulin levels. So targeted oral support, I would put in here your supplements such as berberine, things on that nature, your hepatocore, and also I would put in things like phosphatidylcholine, taurine, the mitochondrial support. Our foundation is going to be a key part of this. Fish oil is going to be a key part of this. So you've got the supplement side, and then of course we have the prescription side. I do write for an occasional very low dose statin for my patients. It's okay if they need it and we've maxed out everything else and we still need some support in that area. I do write for metformin. I think it's a good medication. We do use GLP-1s because reversing that metabolic issue, everything is risk benefits. The risk of having unchecked metabolic syndrome is higher than the risk of the GLP-1s, in my opinion. So we risk benefit balance that discussion and we put people where they need to be. So that's your typical stuff we've always done. Curcumin, resveratrol, ALA. We've got a whole list of things. L-carnitine we can add. Fat burner shots we can add to all of that. Next is where the game changes. So we have the NAD, we have the glutathione. Those are wonderful. But MDI, the mitoregen, is reversing cirrhosis. It is reversing cirrhosis. I'm going to show you 2 cases tonight of patients that we have had that we now have. We've been doing this long enough that we have the befores and the afters. And we have one patient that's fibrosis was reversed, and we have one patient that cirrhosis is getting better. That should have been on a transplant list, but isn't, but is getting better and getting off of that. And it might be somebody sitting next to you in the office if you're in our office. We don't talk about why they're getting MDI, they just are. And then there's the advanced protocols, right? We can always do EBU, HBOT, healing peptides, anti-inflammatory peptides. We've got a whole host of things we can do. But MDI, I have a patient that I've seen recently, and truly that's the only option. We're doing all of the other things, but that's the only option, which is fantastic because we didn't even have an option before. So again, what are we going to do for you based on your specific scores? If you have fatty liver, so just a high CAP score, we're going to do the liver defense, hepatocore, and berberine. Hepatocore, hepatoguard, so that's your black aged garlic and your artichoke. And then berberine, I love berberine, it should be in the water. Early to moderate fibrosis, we're going to add, I love milk thistle for the liver. It has been truly remarkable at reversing elevated liver enzymes for us. Adding curcumin to reduce the inflammatory nature of that. Again, adding in fish oil when the inflammation is high. And then our cirrhosis, we're getting you to MDI. MDI is the solution here. We really want to get rid of fatty liver first, and we're going to treat fibrosis element second. So insulin, of course, we are checking fasting insulin levels. We are picking up metabolic syndrome 5 to 10 years before standard medical testing does. So we fix the metabolism, the underlying, reset your insulin, do the intermittent fasting, do the low carb, do the keto diets, get that handled. That's why our patients don't rebound and just gain all the weight back, because we're actually doing it long enough to fix the underlying root cause. Funny how that works. So again, clear the fat first, right? You can't fix the scarring while the fat's still there. So we are going to take care of that. The scar can improve. We are proving that. And then, of course, we have to repair the terrain. So if you have terrible metabolic syndrome because you work nights or you're exposed to chemicals or your circadian rhythm is off, we have to really fix that. I'm a living, walking example of that. Working in the ICU and surgery call for 20 years about killed me. But when you get to the point where you get to sleep at night and wake up during the day and have more of a normal schedule, that starts to fix the terrain itself. One of the things we have to keep in mind, so this is why doctors in silos don't work. This is why your cardiologists can't tell you something without your GI doctor, can't tell you something without your cancer doctor. You are not a silo of symptoms. You are like one connected person, and all of these things interplay with each other. So this siloed medicine, we have to use our specialists for the specific deep dives that they understand, but then you have to really go back to your orchestra conductor who can prioritize this and put it together for you. So your metabolic repair, again, we're going to fix the insulin resistance. We're going to clear the fat, the mitochondria. We have to remember that the gut and the liver are intimately connected. So this is where that Genova testing that we talked about last week comes into it. Think about it. Your liver dumps its garbage into the bowel. The bowel then circulates, processes it, sends it to the colon. In that last part of the small bowel, we actually reabsorb those bile salts back to the liver. So if you have a sick gut, that's going right back to the liver to feed that problem. So we also have to fix the gut issues. We have to fix leaky gut. We have to fix the microbiome. I remember there's actually data if you are cirrhotic or an alcoholic, and you take probiotics, your risk of going into cirrhosis, full-blown cirrhosis and or encephalopathy is much lower if you take probiotics. And then again, softening and reversing the scar, which most people can't do. Okay, so this we build out for each of you individually. So for the fatty liver, the restricted eating window, so the intermittent fasting, high protein, most of us do not get enough protein in our diets. Doing that zone 2 exercise and the strength exercise. Remember, one of the main jobs of the liver is to build proteins. So it builds the immune system, it builds the muscle repair. It's your building blocks. We have to just test and support that. Some things we can do at this level, again, CoQ10, magnesium, B complex, polyphenols, so your green tea, your resveratrol. This is that colorful diet. I don't talk about that enough. The phytonutrients, the plant nutrients that come in the color, what makes the food colored is what actually makes it good for you. So we don't talk about enough eating a rainbow. In that next level, reverse fat and insulin resistance, so structured nutritional support. We went over these: silymarin or milk thistle, artichoke, NAC, NAD, NMN, and then gut support. So making sure we have fiber, we have all the things we need there. The 7 to 10% weight loss, that's your GLP-1s coming in. Increasing the dose of silymarin, betaine, so we may need to increase the gastric acid so you can actually break down and absorb your proteins. Those are all important things. Vitamin C is very anti-inflammatory, and our red light therapy is good for our mitochondria. So we've talked about all these things. Now you see them at work. So your fibrosis stage. As we go through here, your omega-3s or your fish oil, 1 to 2 grams a day. I would actually argue I'm going to take that up to 4 to 5 grams a day if you have high inflammatory markers. Your vitamin D, we want that 60 to 90. Sauna and heat therapy is really good for metabolic syndrome and cardiovascular health. So if you've ever had a coronary event, going to sit in a sauna 20 minutes 3 times a week actually adds years to your life. In that second level, I have a lot of people here adding curcumin. We do Genova testing on everybody. The high risk stage, we do usually get a hepatologist on board. Definitely at this point, alcohol is a choice for an early death. So I know that's a hard one, and it's not just, I'll just stop drinking, but we will do our very best to help people stop with the alcohol intake because it absolutely is a problem. NAC and or glutathione, that higher level omega-3 or fish oil, and then you're scanning every 3 to 6 months at this phase. And then cirrhosis, we still are going to do that hepatocellular screening. Looking for varices. So one of the things I haven't talked about a lot is when the liver gets scarred. So you've got all this blood flow going to the liver and the venous return from the liver. When the liver gets fibrosed, it's like a dam backing up. So it backs up the veins. So that looks like hemorrhoids. Good times. That looks like esophageal varices. So the veins pop out of the esophagus, and those patients can die because one of those breaks and they vomit blood and die, basically. So if we know someone has cirrhosis, they actually do a scope to look for this, and they can put a little rubber band on to band those and reduce the risk. And then mitochondrial support. So how do we prove it's working? If somebody's at the higher end of either fatty liver or fibrosis, we are going to be every 3 to 6 months looking at things. So lipid panels every 6 months, repeating the Fibroscan every 3 to 6. We really need to stay on top of this. So here's one of our patients. So this is a gentleman that was actually doing fine, and then one day just was diagnosed with cirrhosis. That normal score was healthy before that. So the MELD score is actually a combination of your liver enzymes, your clotting factors, because again, if your body can't make proteins, it can't make clotting proteins. And sodium level, because if your liver shuts down, your kidney shuts down too, hepatorenal syndrome. It actually lowers your blood pressure because you can't control the nitric oxide. And so you actually get hypotensive at baseline. So after 4 mitoregen treatments, we went from a pretty high score of 17 to a score of 9. Now, you or I should be at 1 to 4, I believe, on that. I think 4 is the bottom. So higher means sicker. So you can tell this patient improved pretty dramatically. And I think it was 4 to 6 GI treatments. We have another patient that we didn't expect any liver issues, no history of drinking, little bit of metabolic syndrome, but not alarmingly. And the fibrosis score came back at 9.5, which is the significant. And we did 4 mitoregens, and that got reduced to totally normal. So that's a pretty minimal investment to have one of your most important organs working again. So why again are you here? Why is this substantial? If we catch it early, it's totally reversible, and the earlier we catch it, the easier it is to reverse. So just like everything else in this day of technology, you should know your numbers. This one's easily accessible. We have it in our office, 10 minutes, non-invasive. No reason not to know this number. And again, the liver is the only organ that if you cut it in half, it actually can regenerate itself. So you might have heard of a liver transplant where they take half the liver and give it to someone else, and then the donors regenerates. So it is the organ that keeps on going if we give it the right environment. So find out where your liver really stands. Most of you are already plugged in with us. If you're not, my question is why not? But if you don't have a Fibroscan yet, do it now. It's a great test. It's telling us a lot of information for people. One of the things I wanted to go back and talk about, so there's a lot in the comments. Go ahead and start to drop your questions in. Fructose. So if you drink Coca-Cola, if you drink sugar soda, not that diet's much better, trust me, I'm aware. But if you are drinking or eating high fructose corn syrup, fructose is actually directly toxic to the liver. Directly toxic. So this is not measured with glucose because it's a separate sugar molecule. It doesn't spike insulin levels. So that fructose that you're getting, not only is your blood sugar spiking from the sucrose part of it, but the fructose is absolutely straight toxic. So look at your food, go to your packaged food in your pantry and see how many of the products, the first one or two or three ingredients is high fructose corn syrup, and just dump it in the garbage. Ketchup, barbecue sauce, salad dressings. You will be blown away if you haven't done this experiment, how many things are absolute poison, and that's even before we get to seed oils. So, if I haven't convinced you yet and you haven't had a Fibroscan, what are you waiting for? Time for questions. Okay. Yeah, one of the things that I'm seeing is if you have a young person that is diagnosed with advanced liver disease, it's pretty easy to slap the alcohol label on that, and then you're off the hook as a clinician for digging in. The problem with that is there's a lot of people who lie to us as healthcare professionals. They don't exactly tell us, like, I drink 4 bottles of vodka a day. So you do have to make some assumptions there and not be naive, but it is a laziness factor. And I don't think every single person who has liver issues is just that. Okay, Zevia has some stevia, so it doesn't have the high fructose corn syrup. Might be a better option. Fibroscan, quick and easy. So really not a big deal. Any questions about liver disease, about what we're talking about? Do you have anybody you're concerned about that you think you should share this video with so that they get? I actually had a couple people message me on social media and say, hey, my family member has this. A lot of us know people with advanced metabolic syndrome, family members that we're worried about. You don't have to be a concierge patient to come in and get a Fibroscan. We've actually set it up so that somebody could walk in off the street, get the test, we interpret it and give them our recommendations on the supplements. And obviously, if they have more serious disease, we would recommend following with us more acutely or seeing a hepatologist. How often should you get the Fibroscan if you don't have anything concerning? I would say once a year or less if everything looks good. So it's definitely not something I want to overtest. Once a year for the 10 minutes and ease is probably reasonable. If you're good for 3 or 4 years in a row, we can probably back that up even more. Can you see them? So you can screenshot these if you can see the slides. I'm getting a yes, the slides are up. Cool. Okay, so here's the two things you get off of the Fibroscan, the CAP score and the fibrosis score. So those two are the measurements. And then we'll go to, there's your fatty score numbers. Nope, sorry, hold on, it flipped. There's your fatty score numbers. So your 250 to 300 is your range. Under 250, you're good. Over 300, we're bad. In the middle, it's graded. Yep. And I'll show you the other one too. So this is the fatty one. The fibrosis one is the one tied to mortality. So I could argue this one's more important. So under 5.5 is good. Over 12.5 is very bad. I would make the argument over 10 is under 5 is good. Over 10 is bad. And then in the middle again, it's graded. So I've been on a couple of trainings with the Fibroscan team. Again, this isn't an integrative test. This isn't some woo test that we do. This is in most major hospitals. This is in GI clinics. I tried to get our patients into a GI clinic and we called 3 times and they wouldn't call me back. So they lost my level of interest and I said, I'll just buy one and we'll put it in our office and get it. So these are easy to do, quick, fast, available to you. So I would highly consider it. Any last questions? Okay, just to remind you, this is our quarterly focus. We're going to be talking about the gut and hormones. So, the liver is one of the most important parts of the gut. So, that's why we're talking about that tonight. We will continue curating different topics for you. Again, we're going to talk about how the microbiome is tied to the terrain next week. I don't remember the other ones coming up, but I think we have a talk coming up about the different hormone testing and how it's important to consider that, how we manage menopause, how we manage menopause. If you know anybody who's a little bit crabby and any men who just bought a convertible in the middle of life, that might be a sign. We have a whole bunch of great topics coming up. So thank you very much for being here. Until next time, take care, God bless, and good night.